When you failed the NCLEX exam, you got a test report of your exam. Did you?
Yes. Yes.
Okay. Now, if you check that test report, right, you will see where you had above the passing standard, below the passing standard, near the passing standard. Right. The first eight session is the eight client need. The other part from clinical judgment downward is the next generation NCLEX questions related to case study and all that. Right. So now, but we are talking about the eighth client need because the eighth client is still one that make up the clinical judgment. It's just that they are graded separately. But the eighth client is starting from management of care down to um physiological adaptation. You saw areas you had above, below, near the passing standard. Now, this eighth client need, if you pick maybe the area you had below the passing standard or near the passing standard, you will most students always used to feel like, oh, that's where I need to pay attention to the most. Now you see that particular section, maybe you are near below, has content under them. Now the content under them is what you need to study to be above the passing standard in that particular um client need. So have you seen the client need and the content under them before? Have you?
Have I seen the client need? I don't understand.
Yeah. Have you seen the client needs, the NCLEX test, and the content that is under each of them before? No.
You mean in
Yes.
my question? No.
No, no, no. Like the document. Let me
No,
show
no,
you.
no, I've not seen that.
This document right here on my screen. Have you seen it before?
No.
Okay. Now let me walk you through the document. This is the document that show you everything that will be tested on the exam or everything related to the exam. Let me just go straight to the client need. You've not seen this before, right?
No.
Okay. So this is what you get tested on the NCLEX exam. Now, if you go through your test report and you see where you are either above, near, below the passing standard, right? You will be able to as well to see something unique, which is each of these clients they carry specific percentage, right?
Okay.
Now, one thing is not to just study. One thing is to understand what you are studying. Many students don't understand what they are studying. They study, pay attention to a particular area, but at the end of the day, that particular area is not enough to make them pass the exam. For example, now, take for instance, you are paying attention to this area, this area, this area. The most students like to do that. They look at it and they say, I feel like I understand this better. So let me spend my time on this and then I will cover the rest later. Now, this is just going to give you what? 27% of what the exam is going to test. You see, we have various high tested areas on the exam. Another thing is imagine failing this part because you need to be above the passing standard, right? Imagine having
Yes.
near the passing standard or below the passing standard year, near the passing standard or below the passing standard year, near the passing standard or below the passing standard year. The person has already failed the exam because these are top tested area, right? The NCLEX require you to know all this area the most because they are very important to the field of nursing. So that's the reason why in order to study, you don't just want to study just the way you like. You want to start from this, 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 this. These five area, right, I numbered on the screen, give you 73% of the exam. You need just 60% of the exam in order to be um above the passing standard. right? Or have that knowledge that require you to pass the NCLEX exam. Right. You see these areas, one, two, three. That's just 27%. They are very important as well too, but at least let this area just be like a boost. These are the area you need to spend your time on so that you can be able to pass the exam successfully. The goal is to make sure you are done with the program and you have the ability to pass the exam um in 85 questions. Right? It's possible, it's not difficult. It's just understanding. Once you understand, you end up finding that the NCLEX is predictable. It look like you are taking another practice test, and yeah, everything move on from there. So now the the next thing is to understand the content that is under each of these client need. Now, if I go down the document, right, you will see the content. Now, for management of care, these are the content right here. The content the NCLEX expects you to know in order to be above the passing standard under management of care. These are everything listed right here. Now, one thing you will notice about this content is that they are not written in form of topic. They are written in form of care. In nursing school, you covered advanced directive. I don't really know so much about nursing school in Nigeria though, because I did not school in Nigeria, but I'm just saying, right? I don't know what they cover, but I'm just saying like advanced directive, I did it in nursing school. So, but now on the NCLEX, advanced directive is not given to you as advanced directive. Instead, the NCLEX is telling you what you should do as a nurse related to the advanced directive. Advanced directive is a topic. Integrate advanced directive into the client plan of care is what NCLEX want to test. That is the care NCLEX want to test. NCLEX want to see how can you integrate that advanced directive that you learned in nursing school into the client plan of care. When you think about nursing, when you think about topic, right? When you think about topic, you accumulate nursing information. But when you think about care, you accumulate steps. Because every care comes with step. If they ask you now, oh, how do you insert urinary catheter? You start listing in step. How do you do this? You list in step. How do you delegate? You list. How do you this? You that. So, but if it's topic is just nursing information, but care comes with step. So when they say integrate advanced directive into the client plan of care, there's a step. Now, NCLEX will write the question related to that care understanding. So if you are studying and your studying is related to just only nursing information, the question will be difficult. Why? Because you don't understand the care involved. Right. So same thing with delegation. You need to understand the care. Everything right here is written in care. Like the NCLEX is telling you what you should do as a nurse or what you will be tested on as a nurse. You'll be tested on delegation, supervision, organizing workload, practice and advocating for cost-effective care, initiating, evaluating, updating claim plan of care, provide education to clients and staff about their rights, responsibility, advocating for it, collaborating, managing conflict, confidentiality and privacy, handover reports, approved terminology when documenting, admission, transfer, discharge, prioritization, ethical dilemma, code of ethics, consent, verifying, receive, verify, implementing healthcare provider order, utilize resources to promote quality client care, recognize limitation of self and others, and utilize resources, report client condition as required by law, provide care within your legal scope of practice, participate in performance improvement projects, assess the need for referral, and obtain necessary order. This is very important. This management of care is very important. You need to know you cannot even afford to have near the passing standard or below the passing standard there. You want to have above. The moment you have above here, it gives you like you give the NCLEX a good signal about you. Right. So you need to pay. Nothing's difficult here. All you just need to do is to pay attention to the care, and when you see question, how do you answer it? Right. How do you answer it? That's just it. This the same thing. Like the same contents. Like we have content under other areas as well. So the safety and infection control. These are the contents. Health promotion and maintenance. These are the contents. Psychosocial integrity. These are the contents. Basic care and comfort. These are the contents. Pharmacology. These are the contents. And then reduction of visits are the content. Lastly, physiological adaptation. These are the content. I will send this document to you so that you can be able to as well to know the content. Now, all this content is they are related to care, right? Like we started by talking about the 8 client need. Now I
Yeah.
showed you the content, but the NCLEX don't test the content just like that. They test the content related to concepts. So we have the client need, we have the client needs, we have the content, and we have the concepts. Right. Now, these concepts, what the NCLEX mean by concept is how do you, as a nurse, carry out a care? According to nursing in the US, there are 6 ways that you will carry out any care, regardless of the care. You see, every content that's right here, every care that's right here, there are 6 ways you will carry it out. Right. Let me show you the concept here. We have 6 of them. We have caring, we have nursing process, we have clinical judgments, we have communication and documentation, we have culture and spirituality, and we have our teaching and learning. So this is it right here. These are the way you will perform any care in nursing: caring, clinical judgment, communication and documentation, culture and spirituality, nursing process, teaching and learning. When you see your question, if you are unable to identify this one of these 16 in that question, it means you don't understand the question. Like when you see a particular NCLEX question, you are identifying one of the 3 process, which is 1, the client need; 2, the content; 3, the concept. When you see the question, you're supposed to be able to tell that this question fall under the caring concept. This question fall under the clinical judgment concept. This question fall under communication and documentation concept. This question fall under culture and spirituality. This question fall under nursing process. This question fall under teaching or learning. That is how you will be able to answer the question effectively. Right. Because now when you see your question, you'll be able to like sense that this question is related to caring. How? When you understand how caring question look like. Like now on the screen right here, you can see right that it said caring involve interaction of the nurse and the client. Now, when NCLEX give you a particular question and the question is saying the nurse is interacting with the client, I can 100% guarantee you that that question is testing caring. Now, how do you answer caring type of question? Caring type of question is simply therapeutic communication, because there are 6 ways, which I said earlier on, that NCLEX believe nurses carry out care. Sometimes it's not by giving medication or performing procedure. Sometimes it might just be your what you say to the client. The client might be worried about their condition that they got recently, and all you just need to just do is to use therapeutic communication to make them feel better. So that is one way of caring for the client. So, but how would you know that the NCLEX wants you to use therapeutic communication to answer that question? That is when you recognize the question in the first place, right? As a therapeutic communication question. So the reason why a lot of students struggle with NCLEX questions is because they cannot even recognize the care in that question and how they are carrying out the care. So the answer don't look obvious to them. It look hidden from them. That is the reason why they need to think about what they have seen in a particular textbook, in a particular program, or what they have crammed, memorized in order to answer the question. Whereas the answer is not far from the screen. Now, clinical judgment as well too, uh you have questions that fall under clinical judgment. Your case study fall under clinical judgment. Your bow tie fall under clinical judgment. Your chat question fall under clinical judgment. Any question that involve critical thinking fall under clinical judgment. Right. Now, some certain questions fall under communication and documentation. You will see that question, and then once you read the question, you'll find out that all what the NCLEX just wants is for you to either communicate something to somebody or document something. That's what you will see in the particular question. Now, the other part is culture and spirituality. This kind of question is rare on the exam, but once you get one, it's very easy. As what the NCLEX just wants you to do is to respect client culture and spiritual life. Like if they tell you, oh, a patient stated they don't want something, all you just need to just do, if the answer is saying you should educate them about the risk, fine, educate them about the risk. If it's a nursing procedure, educate you have the it's within your scope of practice to educate them about the risk. If it's a medical doctor procedure, then you need to let the doctor know about it. Other than that, you are not going to select any answer that involve forcing them into doing it. You is the only two things is to educate them about the risk and respect their decision. That is culture and spirituality type of question. Nursing process, um in nursing school, right, we learned assessment, diagnosis, planning, intervention, evaluation. But on the NCLEX exam, right, NCLEX only focus on assessment, intervention, and evaluation. The diagnosis is already there. There are two situations you can see on the NCLEX exam. Is either they will provide the diagnosis for you, or they will just give you symptoms. NCLEX don't expect you to diagnose because NCLEX use medical diagnosis. So nursing diagnosis, yes, in nursing school, but on the NCLEX don't expect you to diagnose nothing. NCLEX just expect you to care for client. So you might think about situations, right? What is going on, but NCLEX is not really asking you to diagnose. NCLEX just wants you to assess. If the patient situation require assessment, then assess. If the client situation is so clear that intervention is the next step, then jump to intervention. And if the question is testing related to evaluation, then evaluate. Anytime NCLEX is testing evaluation, is very straightforward. I will show you some certain questions that's related to intervention, evaluation, I mean, and you see they are very straightforward. You can easily tell that that question is testing evaluation. If it's also intervention as well, too, there are two ways NCLEX tests intervention, directly and indirectly. The indirect one too, you will see it will tell you that it's testing intervention. The assessment is not direct because sometimes you might be required to do assessment in that question. Sometimes it might be intervention. It's your judgment that will tell you which one to do. But just take note that your intervention, your nursing process wants you to assess, intervene, evaluate. Right. Now, teaching or learning. Um that's pretty much common as well. So I know you see questions on the exam that say the nurse is teaching the client about so so and so, or the nurse taught the client about so so and so. Those are questions that fall under teaching and learning, or question that is saying the nurse attended a staff education program about so 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 and so. It's teaching. Teaching involve teaching the client and expecting feedback, or teaching something and expecting feedback. You teach to make the client understand. So you look at what are you teaching, right? And what is the client understanding from that teaching? Or what's the main teaching involved in what you are trying to teach. And also, once you have walked the client through the whole teaching, you want to now see what they understand. Do they understand what you taught them or not? Right. So that's just the teaching. Right. You are going to see many questions. You'll be able to understand this process. Now, I will show you NCLEX past question. I don't know. When you were preparing for the NCLEX exam, did you use the NCLEX past question to study?
Yeah, I got you word that time.
No, you word is not NCLEX past question. You word is third party question. We have NCLEX past question, which are questions that have been previously tested on the exam before.
No, I didn't
You know that.
use class past question.
Okay. Have you seen this document before? This one on my screen? No.
I think I'm not sure that is one on this NCSBN page.
Yes, is the one. Did you use it to
Okay.
study?
No, no, no. I
Oh, okay.
just
When you were taking the NCLEX exam, were you the only one trying to take it, or you had people that were trying to take it as well too?
yeah, I joined the group then, but they didn't use all
Um,
this kind of material. They just use and just um we just join classes like this. So she would just the tutor would just come on and teach
mm.
us with sounders and all those kind of materials.
Oh, okay.
And she will
Oh,
encourage you to buy you word, hatcha.
uh, yeah. The pass rate for the NCLEX is 88% to 94%. That's the pass rate, which means a lot of students don't fail the exam. I'm talking about people that are taking the exam for the first time, right? Which means
Okay.
a lot of students don't fail the exam. It means only 6 to 12% are the ones failing the exam, which, if you ask me, is pretty much uh,
No.
a good uh, thing. But my goal is not because of the students that are really taking the exam the first time. It's because of the students that are struggling, right? If this was the reason I decided, if this was what I saw, I would not have decided to become an NCLEX coach. But what I saw is not this. What I saw is that when this first timer who happened to fail the exam end up becoming repeat test taker, their pass rate is 37 to 50%. Now, meaning they struggle. When I was asking somebody or when I was trying to carry out my research, I asked myself one question, which I asked a lot of students as well. I said, who do you expect to pass the exam? Somebody that have taken the exam before or somebody that is taking the exam for the first time? We all agreed that somebody that have taken the exam before should be the one to pass the exam next. Unlike somebody that is taking the exam for the first time, don't really know what to expect. But guess what? The NCLEX pass rate is saying otherwise because the repeat test takers still struggle 37 to 50%. And I look at it, the NCLEX is not difficult. So why are repeat test taker struggling? Because I expect the repeat test taker to even be this high and maybe first timer to be this low. So when I looked into it and I saw a lot of students are understanding NCLEX the wrong way. So that is why I decided, okay, let me step in to help student pass the NCLEX exam. So far, so good. I've been doing this for the past 3 years. I've helped over 1,000 students pass the NCLEX exam successfully. And I would also want you to be part of that number as well too. Right.
Yes.
So now NCLEX, when NCLEX want to write their question, NCLEX writes the question, every NCLEX question, any question you saw on the exam related to three parts. We call it the body of the question, the stem of the question, and then your answers. Now, the body of the question is, it's an information that make you start processing the kind of care. You understand? It make you start processing the care that the NCLEX will likely test you. So the body of the question always used to send a particular signal to you related to what the question is testing. Now, the stem is what we call the examiner question. Like it's just like um it's like the examiner question. It's just like, the body of the question is just like, let us say I ask you to read a storybook now. And I say, once you read this storybook, I am going to ask you a question and you're going to provide me the answer. Now, in order to give me the correct answer, it means that you need to understand the storybook so well so that when I ask you a particular question related to that storybook, you'll be able to give me the answer. Now, the reason why you will not be able to give me the answer, obviously, you know, because you did not maybe understand the storybook, or maybe you did not read it very well, or you skip a part or something like that. It's always this that's the problem. So if you are struggling to answer any unclear question, it's the body that you fail to understand that's the problem. It's not the stem. The stem is the examiner question. It's just like when I ask you, have you used the NCLEX past question before? You said no. So the problem is not my question. The problem now is you don't even have an idea of um that the NCLEX past question existed. Right. If Adimi, you have an idea the NCLEX past question existed, you could have used it. And when I ask you, have you used it before? You say yes. Now, every time you are trying to answer any question, always pay attention to the body so that you want to understand what the examiner is testing. The stem is related to what the examiner is asking, related to that body, and the answers are always going to say something. So you need to pay attention to what each answers are saying. This question on the screen, you can easily break it to the body, the stem, the answer key. If it's some certain exam, like every question always used to have this body, stem, answer keys, right? But NCLEX is very clear on it because you will always see this to differentiate the body, the stem, and then your answers. The first part is the body. The second part here is the stem, and all this right here is your answers. Now, the body, you want to read it to make sure you identify the key in that particular question. Right here in this question, it is saying that we have the charge nurse. Now, let me give you something so that you can understand. You are not the charge nurse. You, on the NCLEX exam, you are going to be the nurse. But as the nurse, you are working with your charge nurse and you are working with other staff member. This The staff member can either be LPN or UAP. Do you understand what I'm saying?
Yes.
Okay, great. Your staff member can be LPN or UAP. NCLEX can decide to tell you the kind of staff member you are working with if they want you to pay attention to that staff member scope of practice, or they might just leave it as staff member. The staff member can also be another RN as you as well too. So anytime the NCLEX says staff member, you don't need to think about scope of practice because they did not disclose the person you're working with. So it means that everything applies to that staff member. But if NCLEX disclose, if NCLEX is saying maybe the nurse is working alongside with LPN or the nurse is working alongside with UAP, it means that NCLEX wants you to take into consideration the scope of
Yes.
practice. Do you understand scope of practice? What
Yeah.
I mean by scope of practice? Okay, great.
Like what they
Now,
can, their limitations to what they can do.
okay, yeah, that's good. Now, so that is it. Now, when you want to take the NCLEX exam, this is what I have seen many times that sometimes make me ask myself, why is it that that particular student wants to be a nurse? Because when I ask, what are your role as a nurse? Many students struggle to even mention one, and I'm like, and you said you want to pass the NCLEX exam, you barely even know your role as a nurse. I'm expecting you to start telling me, oh, as a nurse, I give medication, I provide teaching, I make sure I prioritize well. All these things should not be even be far from what you're saying. But you say, I say, you are taking even more than 10 seconds to even mention just one thing. And you said you want to become a nurse. So how do you want to even pass the NCLEX in the first place when you don't even understand your role as a nurse? Now, charge nurse, you need to understand the role of a charge nurse. Because you will see, I can 100%, even without you telling me, I can tell you for sure you saw child nurse on your question because it's there. Child nurse is there, you as a nurse is there, staff member is there. These three things are related to nursing. So NCLEX will test it. Do you understand your role of the child nurse? Do you understand your role as a nurse? Do you understand your role as a nurse related to other staff member? Because you will delegate, you will supervise, you will prioritize. These three things, you cannot escape it on the NCLEX exam. You cannot escape it. So it's there. So when you want to take the NCLEX exam, you need to understand the role of the charge nurse, your role as a nurse, as well too, the role of the LPN, the role of the UAP. So when you go come on the NCLEX exam and the NCLEX is saying the charge nurse has received a change of shift report, you will understand why the NCLEX is speaking this language. Another thing I want to tell you is the wording, right? Now, when the NCLEX, pay attention to this, very important. When the NCLEX use D and A, when they say D, it means that this is the person that is carrying out, like that is doing something, right? This is the person. If NCLEX say A, it means that this is the person that is receiving or need the care in that question. So anytime you see D, that's the person that is trying to do something. When the NCLEX say A, this is the person that needs the care. So pay attention to the person that needed that care. A, like the nurse is caring for a client. You see, they start with the nurse is caring for a client. They said a client. They did not say the nurse is caring for the client. They said the nurse is caring for a client. So it means that the nurse is the one carrying out the care. The client is the one receiving the care. So pay attention to this because you want to understand who needs care in that particular question. Right.
Okay.
So right here, we have more than one client. So that's the reason why obviously they cannot use A because A is like for single client, right? So we have client,
Yeah.
that's why I say following client. If it's one client you are caring for, they will say a client. So understand that. It's like shortcut to make you understand who is receiving care, who is giving the care. Because sometimes it might even be the nurse that needs the care. And you will not know. You will think it's the client, and you will fail to understand that it's even the nurse that need the care. Because there are situations at which it's the nurse that will need the care in most student question. I've seen that before. So that's what I'm trying to explain that. You will notice that every NCLEX question, right? 90% of this time, we always start with the nurse, the nurse, the nurse, the nurse. Many students don't understand this pattern, right? I'm trying to make you a test writer. Maybe you might decide you pass the NCLEX exam today and then you will want to write the NCLEX exam for them. I'm trying to make you understand these things. You will notice that every time the NCLEX always should say the nurse, the nurse, the nurse, the nurse. It's not because they are repeating it. That is just how they want the question to be written. They don't want confusing type of question whereby um you are trying to read a particular question, another question is written in a different way, different question are trying. No, 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 no. Everything should be unique. If you check this one now, it's saying the charge nurse. If you look the next one, it will say the nurse. You will check the other one again, the nurse. If you check the other one again, the nurse, like it's just the nurse, the nurse, the nurse. The moment it's going to change from D to A is maybe that nurse is the one that need the care. For now, it's the nurse that is carrying the care. It's only the client that is having the A. Everything like that is the client that's having the a client. D nurse, A client. You understand? That
Yeah.
might now should like be clear now. So now once you understand this part, now you want now the I don't know your um content understanding now, but let me assume that everything that I will explain in this question you understand it. Now,
Yeah.
the charge nurse, right? Look at this question. It said the charge nurse has received a change of shift report on the following client level. Now, what's the charge nurse doing? Receiving change of shift report. This content is on the NCLEX content. If you have used the NCLEX content to study, you will understand this situation. Now, when you look at the body of your question, you need to ask yourself one thing. Based on this body, what would you do? Remember, we have six concepts. We have concept of caring, we have concept of clinical judgments, we have communication
Communication.
and documentation, we have our culture and spirituality, we have teaching and learning, we have nursing process. So now when you see this right now and you see the charge nurse has received a change of shift report on the following client in labor. Now ask yourself, is this going to be caring? Obviously, no, because caring involves communication between the nurse and a client, which will make me to just do therapeutic communication. This question don't need therapeutic communication because if it is a therapeutic communication question, we are not going to be dealing with following client. We'll be dealing with a single client because I want to have an interaction with one client. So this don't fall under caring. Now, when you move on to the next one, you think about clinical judgment,
Yes.
right? And you think about you will say, okay, clinical judgment, this because we are dealing with following client. Anytime you see the NCLEX giving you more than one client, it's always related to either delegation
Exactly.
or prioritization. So when you are seeing question related to delegation prioritization, it means that a certain aspect of clinical judgment will come into place. Because if it is delegation, you need to critically think the right task for the right person. If it is prioritization, you need to think who are you seeing first. So this kind of question come with a clinical judgment. So this is more suitable as a clinical judgment question. Now, if you think about it, communication and documentation, yeah, are you going to use solve this question with communication and documentation?
No.
Maybe the charge nurse will want to communicate something. Maybe we don't know yet. Right. So we can keep that because it might be okay once the child just gets the information, she might communicate something to you, and maybe that would be the end of the whole story. Or the child don't want you to communicate something, maybe we don't know yet. So we can leave it that it might fall under clinical judgment, it might fall under communication, documentation aspect. Can it fall under culture and spirituality?
No.
No. Can it fall under nursing process? Maybe. Teaching and learning, no, because this is not even teaching and learning type of question. But now, since you have an idea that it can either be clinical judgment, it can either be communication documentation, it can either be nursing process. Now, you just need to read the STEM, which is the examiner questions, to see which of the three is appropriate. Now, the STEM, which is the examiner question, is now saying the charge nurse should ask a staff member to first see the client in the. Now, when the question is saying you have different clients, And it's not asking you to only see somebody first. It means what? Prioritization.
Prioritization.
And prioritization is clinical judgment because you need your critical thinking in order to do that. So this question is not a communication and documentation question. You don't need nursing process for this. All you need is your critical thinking. So now we now know this question is related to prioritization. We need to see somebody first. And anytime you are dealing with clients, because we have three types of prioritization. We have prioritization that deal with clients. We have prioritization that deal with tax or procedure. And we have prioritization. What's the third one again? Client, tax, procedure. Let me remember the third one. Client. If I remember the third one, I will tell you. I'm trying to remember. Client. One prioritization deal with client, which is this one. Another deal with tax. Okay. Findings. That's the last one. Findings. Right. So we have three type of prioritization. Every time I ask students and I'm like, what do you understand by prioritization? The first thing they will tell me is, oh, prioritization questions are those kind of questions that involve you to see a client first. That is when I know they have gotten prioritization all wrong. Because prioritization is not only seeing client first. We have three type of prioritization you will see on the NCLEX exam. Some prioritization will require you to prioritize to see client first. Some will require you to carry a particular task. They might give you 4 different tasks or procedure and ask you which one is important for you to carry out now. It's not involving clients, but it's involving 4 clients. Sometimes it might be which medication is important for you to give now. They might tell you a patient is having a particular situation and give you 4 different medications, and you will prioritize which medication is important to give now. That's fall on that task. That is also prioritization. And find this as well too. They might give you 4 different findings and ask you which one would you prioritize. And then you will say, oh, this one is not really dangerous, this one is dangerous, and this one you will prioritize. So these are the 3 types of prioritization you will see. For this prioritization right here on the screen, it's related to client. Now, every prioritization, this, they have their principles. The way you prioritize related to clients is different from tax and procedure, and is different from finance. The principle for clients, right, is what you are going to apply. Now, anytime you are trying to prioritize or carry out any care on the NCLEX exam, I want you to pay attention to one thing. Always ask yourself before you decide, because we have general care and we have specific care. General care is when the NCLEX did not give us a location. It can be location, it can be unit, it might be facility, anything like that was not mentioned. Like, for example, maybe they say maternity, pediatric, med surg, or medical, surgical, something like that. Rehabilitation, all those kind of things, right? They did not mention. So it means that you can think about the care as a general care, because they are not limiting the care to a particular location, unit, facility, or whatsoever. But the moment NCLEX is giving you a location, unit, facility, it means that the NCLEX wants you to use the specific care that is carried out in that particular location. Meaning, if NCLEX say pediatric and NCLEX is talking about heart rate, and then the NCLEX is saying the patient have an heart rate of 36, because the NCLEX is saying pediatric, maybe the NCLEX is saying neonate, we are going to consider this a good respiratory rate, because the respiratory rate for pediatric is what? 30 to 60. But if the NCLEX is not telling us any unit, location, facility, and then the NCLEX is like respiratory rate is 36, then we are not going to be like, oh, wait a minute, this patient is having problem, because generally the respiratory rate should be 12 to 20.
20.
All right. So that is why you need to pay attention to location. Like now, the NCLEX mentioned location right here, labor. And labor is under maternity. Meaning when you are trying to carry out this prioritization you want to carry out here, every patient situation here, you must critically think about it related to the kind of care that occur during labor or maternity, right? So that you don't mm, think about it generally when you should be thinking about it related to that specific location. Right. Now, one key thing you need to know as a nurse, most especially, NCLEX is not going to give you the normal range to those things. It's vital sign. NCLEX can give you normal range for every other thing, but you see that vital sign. NCLEX believe this is your first tool to like that you need to use to care for your client. So they expect you to know your vital sign normal range. Now, I'm going to share on the screen the vital sign that you need to know. Now, we have how many vital sign? How many vital sign do we have?
5. Temperature, pulse, respiration, blood pressure, I think saturation. Yeah, 5.
Yeah, we have five. We have the blood pressure, we have the heart rate, we have the respiratory rate, we have the oxygen,
Temperature.
and then we have temperature. Right, you are right. Five. Now, you need to know the normal range for all this. Now, I want to tell you this. The blood pressure can change based on the client you are dealing with. The heart rate as well too can change, respiratory rate can change. But you see these two right here, they cannot change. Oxygen remain 95 to 100%. Temperature remain 97 to 100.4 degree Fahrenheit. This is what you need to know for the NCLEX exam. Forget what you are going to see on Google. Forget what you are going to see on any program. This is what you need to know. This is what you need for the NCLEX exam. When you start working as a nurse, it can change. In your facility, they might not tell you so amount of temperature is good. Remember, you are dealing with textbook information and you are dealing with a word that they made to be perfect, a nursing word that they made to be perfect. Yeah, when you start working in the hospital, yeah, you might see different things. They might tell you, oh, blood pressure is this, blood pressure is that, the heart rate is this, respiratory this, that. But on the NCLEX, know what you need to pass. Right. Now, the blood pressure can change, heart rate can change, respiratory rate can change, but this can change. Oxygen can change based on one condition. Can you tell me why do you think oxygen can change? For who do you think oxygen can change?
For COPD patient.
All right, that is great. COPD patient. For a patient who have COPD, their oxygen is 88 to 92%. So that's just the only thing you need to know. Right. So anything aside that, yeah, blood pressure can change. So this is what you need to know. So now, anytime you are dealing with temperature, temperature can be related to a lot of things. Ask yourself one question. Why will a patient have increased temperature in the first place? There are two reasons. Increased temperature occur related to inflammation and infection. Right now, somebody can, maybe you can be, I don't know if you like to fight. Maybe you fight with somebody now, and then maybe they beat you up. You have like swelling all over your face, right? If somebody feel to that area, it's going to be warm, right?
Yeah.
Why? Because there's inflammation going through, right, in that area. Does not mean you have infection, right?
Yeah.
So that's inflammation causing your temperature to be high. Now, infection as well too can cause your temperature to be high as well too. So anytime you are dealing with temperature, always know that it can be inflammation or infection. So always ask yourself, what is causing that temperature to be high? Don't jump into conclusion and say, oh, it's infection. Always find out what is causing it to be high. There are different things that can cause the temperature to be high. Always find out what is causing it to be high. Right. So because somebody can have fracture right now and they will tell you the patient temperature is high. It's not because of this patient have infection. because of the inflammation, right? There's inflammation going on. The patient can return from surgery, the temperature is high. Does not mean the patient have infection, which infection is one of the risks, but does not mean the patient have infection immediately after surgery, because it takes like 72 hours before we start suspecting surgery. But less than 72 hours, we are thinking it's inflammation that's causing the temperature to be high. These are key things you need to know. Right. So always know that. Now, that's for temperature, right? But every temperature have the same range. 97 to 100.4. Anything that is higher than 100.4, that is infection. Inflammation cannot be as high as 100.4, right? Inflammation can be more than 99. But if you have anything that is higher than 100.4, it cannot be inflammation again. That will be considered infection, because it's only infection that can go as high as 100.4 and above, like 100.5, 106. No. Inflammation cannot go as high as that.
Okay.
Right. So that is that for the temperature. Just take note. Now, oxygen same thing as well too. Now, so when this question is talking about temperature right here, right? What do you think? Why do you think the NCLEX is mentioning temperature related to the kind of care you are carrying out, or the location, which is labor? Why do you think the NCLEX is mentioning temperature? Because, like
Maybe
I
the
said, remember I said temperature is related to different things. We can see, oh, a patient have pneumonia, temperature is high. A patient return from surgery, temperature can be high. A patient have meningitis, temperature is high. A patient have so condition, right? Temperature can be to high related, but in order to be able to care for these clients properly, we need to know why the temperature is high based on the client situation. So now this is during labor. So tell me,
yeah, maybe they're suspecting the patient might be having infection
infection. Okay. Yeah, that can be right. So now,
or high fever or something.
okay. So now, what my question to you right now is, um, why are we trying to prevent infection during labor? Why are we trying
So
to
that
prevent infection during labor?
to prevent it from transmitting to the baby, to the fetal, the newborn as well.
Yeah, one of the things is because during delivery, if there's infection, it can cause blindness. When after delivery, we have three medication that we give to the baby. Mention them. Do you know it?
No, actually.
Okay. We have we give vitamin K, we
Okay.
give hepatitis B,
Okay, you mean the vaccine. Okay.
yes, and we
And
give,
BCG. And BCG.
yeah, and we give um erythromycin eye drop. Why? Because we don't know. We are just trying to be safe to prevent the baby from eye infection that can lead to blindness. So, but if we can confirm that the mother has an infection before even delivering the baby, it's not safe to deliver the baby when the mother have infection. So we need to fix the infection before delivery, most especially to give antibiotics before delivery. Right. So, but in this case, that's what the charge nurse got as our first report. The client has temperature of 99.7, but we want to see a client first. But because this client have 99.7 and it's not really more than 100.4, this client can wait. Do you agree?
Yes, please.
Okay. Now you have client two, contraction that are occurring every 30 seconds. Tell me, what do you understand about contraction?
And like the force in which the fetal heart rate, like the fetus is the movement of the fetus.
No. Contraction, let me give you uh, the way I want you to understand it. Contraction is just like now. Babies stay in the uterus for 9 months, as expected. Like we expect it should be above 37 weeks, right? Now,
Yeah.
after 37 weeks, the uterus gets fed up of the baby. The uterus is like, okay, I've been keeping you here for 37 good weeks. Now it's time for you to go out. So now, the way the uterus try to send the baby out of the uterus is by squeezing the baby out. So you see
The
that
muscle of the uterus.
yeah, you see that squeezing is what we call contraction. The uterus is trying to push the baby out of the uterus, like the uterus don't want the baby there again, so it's squeeze. That's what we call contraction. The squeeze trying to push the baby out. So when they say, oh, somebody's having contraction, sometimes it can be true contraction and it can be force, because forced contraction don't last for long. They stop. But you see, true contraction, it lasts. It the only time that contraction will stop is when the baby is out, because the uterus will try everything possible to push the baby out. Sometimes it starts with gentle squeezing to push the baby out. After some time, if you notice that the effort it has made to push the baby is not working, it starts increasing in in contraction. So it can start right now. Just like if I hold your hand somehow tight and ask you, are you feeling the tightness? You might say, no, I'm not feeling it. I might not increase the intensity of how much I am holding your hand. You might not start screaming and not saying, it's paining me, leave my hand alone. Right? That is what the uterus do. So when during pregnancy, we want to monitor that contraction because it might be so tight or last so long that it can become a problem to the baby. Do you understand what I'm saying? Okay, great. So we want to monitor that the contraction is within a specific range that the baby can enjoy or endure. Because when the contraction occur, if you are monitoring the fetal heart rate, you will notice that everything go from normal to abnormal, and after the contraction relaxes, everything come back to normal. Now, if you are monitoring the fetal heart rate and you notice that everything is not coming back to normal, then that time you will not say the baby is suffering from this contraction. We need to do something now. But if the contraction is occurring and the baby fetal heart rate is going from abnormal and is coming back to normal, there's no concern. Right. So, but at the end of the day, there's a specific range at which it's just like now we have ranges for heart rate, respiration, blood pressure, oxygen, temperature, contraction as well to have its range. Contraction is measured in two ways. We have frequency and we have duration. One of these two is measuring frequency or duration. One of these two, because we have two contraction there. So it means that frequency have its own range, duration have its own range. Right. Do you know their ranges?
I think for this early contraction is normal for the first stage. Supposed to be 30 to 60 seconds.
For which one?
For the first stage of labor. During early contraction, it's supposed to be 30 to 60 seconds. I'm not sure.
Okay. Contraction related to frequency, the normal range is 2 to 30 minutes. That's the normal range. For duration, contraction is 30 to 90 seconds. So take note, this is what you need to know for the NCLEX exam. I've given you shortcut right now. Contraction, when it comes to frequency, 2 to 30 minutes, that's what you need to know. Duration, 30 to 90 seconds. Now, it's now left for you now to now figure which one is testing frequency and which one is testing duration, because NCLEX is not going to say use the word frequency, NCLEX is not going to use the word duration. It's you that need to now figure which one is frequency, which one is duration. So I want you to look at option 2 and option 4. Tell me, which one do you think is frequency and why? Which one do you think is duration and why?
This contraction occurring. Question 4 is duration, lasting for 60 seconds.
Okay. So question 2, answer 2
2
is
is
frequency.
frequency.
So lasting means duration, right? Every means frequency, right?
Yes.
Great. That's correct. Every means frequency. Anytime you see the NCLEX use keyword like every related to contraction, they are talking about frequency. And anytime the NCLEX use lasting related to contraction, they are talking about duration. So when you see contraction occurring every, think about 2 to 30 minutes. When you think about contraction lasting, think about 30 to 90 seconds. We can both agree together that this is within range, 30 to 90 seconds. True or false?
Yeah. True.
So this patient is fine. We are left with 2 and 3. Now, 30 seconds, me and you can both agree that it's not within range. True
Yeah.
or false? So these
Yes.
patients look like they need care. So let us keep these patients. Now we are left with option 3 now. Respiration of 26. I was coaching a particular student, and when I asked her to answer this question, she was quick to say, number 3 is the answer. And I asked her why. She said, because she applied the rule A, B, C, airway, breathing, circulation. She was like, oh, the respiratory is high. Maybe the patient is having respiratory issue. Now, you see, when I tell you the previous time, I said, pay attention to the care that occur related to the particular location unit facility. Adding being this question is related to general care. We might say, maybe the respiratory rate is high. But because this is related to maternity, respiratory rate that is high during maternity, most especially labor, is because of physical exertion, the stress during labor. Right.
Hmm.
Yeah. So that is the reason why the mother is having increased respiratory rate, because the mother have to do a lot of pushing during labor, and which cause her respiratory rate to be high. If you are somebody that go to the gym, right? If after a long period of time working out, guess what? You will be tired. If you check your respiratory rate is going to be high. Let us say you are somebody that like argument. If you are arguing with somebody, serious argument, your respiratory rate will be high. Let us say you are somebody that like, maybe you don't like taking transport or taxi or anything like that, you like walking. If you decide to walk, your respiratory rate is going to be high. Let us say you try to like get few steps using treadmill. If you do that, your respiratory is going to be high. Let us say you play sports, maybe football, basketball, your respiratory rate is going to be high. Let's say you decide to jog around your house, your respiratory is going to be high. All these things I mentioned, don't require you to be admitted, don't require you to be in any form of oxygen. They only require you to do one key thing, which is to rest. These are expected things because these are the reason why your respiratory is high. Remember the last time when we talked about temperature as a vital sign, I said find out why the patient is having that increased temperature so that you don't misjudge or misinterpret the temperature. Because you might be dealing with inflammation and you think it's infection and you are giving antibiotics. Why are you giving antibiotics for inflammation? Because inflammation have its own medication. What is NSAID used for? For inflammation. So if it's inflammation that is wrong with the client and the temperature is high and you are giving antibiotics, you fail the question. But if it is infection and you are giving antibiotics, antiviral, antifungi, you get the question right. So when it is respiratory that's high, you also want to pay attention to what is causing the respiratory rate to be high. In this case, it's because of the physical activity. Anytime the NCLEX is telling you a patient is having deep snare related to exertion, increased respiratory rate related to exertion, those things are not priority because all what that patient need is to rest. Rest. That's what the patient need. Once the patient rests, the respiratory rate will return back to normal. So with that being said, in this situation, because we know if this patient rests, everything will be fine. So this is not a priority, right? Is that clear, please?
Yes, please.
All right, great. So now, which brings us to um having our answer as option two. Any question?
No, it's clear.
All right, great. Now, um, so far so good. What do you learn?
Yeah, so like you mentioned, when you see a particular question, you should learn to understand the units or the location and the facility of the question.
Okay.
So by
Oh.
understanding that, you'll be able to do your prioritization rightly. So
Mm-hmm.
that way, you know how to easily rule out the wrong answers faster. Is a faster way if you understand your units. So like now, if since I know that this question is about labor, which is under maternity, I
Yeah.
understand that the temperature, the normal temperature is
Mm.
95 to
97.
197 to 104, 100.4 rather. So
Mm.
and 99.7 falls within the right range. So that's that way you will be able to cross out this or as the wrong answer. Then
Mm-hmm.
if you understand the frequency and the duration, like you mentioned,
Mm.
the unit for the frequency and the unit for the duration, then you'll be able
Mm.
to cross out this one as well. So that will now give you, then you understand that when a patient is, when a lady is pregnant and she's in labor, she's going to
Mm.
be in distress and also going to be respiration
It's
will be
going to be
high.
right. Sure.
Yeah, so it's expected that she will have 26. So that one too is expected to be normal. That's normal for this
Yeah.
particular patient because
Mm-hmm.
of the condition, the situation she is. So we
Yeah.
rule it out. So that would that give us the contraction of 30 to 30 seconds, which is supposed to be between 2 to 30 minutes.
Yeah.
So that one now make it to be.
All right. All right. Sound good. I love the fact you were able to pick up everything. Now, to recap everything we have been saying, NCLEX is all built on your client need. So you need to know the eight client need by heart. If I ask you now, maybe like another time, I'm like saying, okay, mention all the client need that we have. You should be able to tell me, list everything. Because if you want to become a nurse, you need to know those things. Because that's what the NCLEX want to test. If you want to pass the exam. Right. So you need to be able to know those things. Now, as I said, I'm going to send you the document. It has the content in each of them, right? So the content, I want you to get familiar with it. So I want you to go over them, right, and get familiar with it, so that when you are seeing a particular question and you are able to identify what the NCLEX is testing, you can easily now say, this is a management of care question. This is a safety and infection control question. This is a health promotion question. Why? Because you identify the content. Like this particular question we are seeing on the screen fall under
Clinical
um
judgment, prioritization.
no, the client need to fall under is health promotion. Let me show you right here because it's testing client in labor. Now, if you go to Ed Promotion right here, you will see client in labor right there. Let me, this is Ed Promotion right here. Now,
Okay.
if you look at it right here, you can see client in labor under Ed Promotion. So that is what the NCLEX is testing here. Right, client in labor. So this question fall under Ed Promotion.
Health promotion.
So
Okay.
under Ed Promotion, the NCLEX is testing prioritization that fall under the concept of clinical judgment. So one, you want to know the client need that is being tested, the content that is being tested. The client need is Ed Promotion. The content is client in labor. And then the concept is clinical judgment, which is prioritization. That way, if you can know your questions like that, trust me, NCLEX is not going to be difficult again. The only thing you will be missing now is the nursing information. Maybe you don't remember what the normal range for contraction is. Maybe you don't remember what the normal range for temperature. Those are the only things that you just need to kill the exam. That's just it. NCLEX is not difficult, right? Now, what I've seen so far so good is when I make students understand the NCLEX exam, they always struggle with just um few things related to the content and question. One, most of the time they don't know the content before, but when I tell them, oh, this is the content, this is how you where you get the content I share to them. Now, is either they don't know how to study the content or they struggle with retaining the um retaining when they study the content. That is one. Is um two is related to the question, right? Which is one, they don't practice the right question. Instead of practicing NCLEX past question, they practice random question. You want to build your knowledge strongly with NCLEX past question, so you know how the NCLEX writes the question. One and two, you want to know how to break down the question. You see how I was able to break down this question? That is how everything is going to be clear. If you do that for 100, 200, three questions, that same way, 400, that same way, trust me, you are going to kill the NCLEX exam in 85 questions. I can guarantee you that because not only you will be building your knowledge, you will be building your ability to become a safe nurse and care the way the NCLEX wants you to care. Right. So that is what I'm going to be guiding you through, right? Um, all through the lesson. Right. So um I'm going to end the Zoom now. um when we meet
Okay.
again, we are going to, you are the one going to be answering the question this time around. So now I'm going to be observing the mistake you are making. So what you are going to do is that I'll put the question on the screen, you are going to answer the question, I'll give you the time to answer the question. Once you answer the question, you answer it within 2 minutes, because on the NCLEX exam you should answer every question within 2 minutes. Right. Maximum 3 minutes. Right. If you want to make finish your exam without no wasting time. So I'll give you that time. You answer the question, then I will note the mistake you are making, and that way I'll be able to fix it. So the more I am fixing your mistake, the more you don't get to make those mistakes again. If you take note of those mistakes, and then the more you keep building your understanding, you yourself, you will start now knowing, oh, this would be probably the reason why I failed before. This is where I need to pay attention to. So me and you now, we now know areas to focus on the most and build this content knowledge, and we have the ability to pass. Any question?
No question. I just wanted to ask that. Is the classes like how many times a week? So I can, or is it when you're available? I don't know.
Yeah, the class normally, it's not the class normally, it's like I have the pre-recorded classes that I have done already that you can walk through it your own self, whereby we follow the same plan. I know the plan. All I just need to just do is to keep checking up on you and finding out what you are doing, what you are not getting, and then I now decide, okay, since you are not still getting this thing, I will now decide, okay, let's meet on Zoom to fix the problem. Right. But the reason why I meet with every student that joined the program one on one the first time is because I want to make sure that you understand the whole process of the program, right? What you need to understand. I don't want situation whereby you are, because students are used to this. You just join a particular program and you are just figuring everything out yourself. I don't want you to figure something out and it's not really what I want you to understand. So that's why I'm taking my time to give you the basic, diagnose
Okay.
to see the problem, and then along the line you get to now start using those knowledge to study, and then me, I will make sure I hold you accountable to